Hi, I am going to be sharing about what a speech language pathologist does, who we are, and what we do. So a little bit about me. My name's Allie. I am currently a senior at Cal State University San Marcos in the bachelor's program for speech language pathology. I'm going to graduate in December and then start graduate school the following fall. So what is a speech language pathologist? Speech language pathology consists of speech and language, of course. It consists of cognition, which includes things like attention, memory, problem solving, things like that. We assist in that area. We assist in dysphagia, which is a swallowing disorder. We assist in neurogenic and neurological disorders. We help with fluency, such as repetition skills or things like stuttering, and then also augmentative and alternative communication devices for people who need to communicate in a different way. So there are a lot of job settings to look into if you're interested in this field. There are schools that you can start at from elementary all the way to the university level. You can choose to work in a hospital, you can choose to work in a private practice, a residential or non-residential care facility. You can do in-home therapy where you go to somebody's house to provide your services. You can be a traveling speech therapist and travel across the world or just travel in the United States. You can also work in the newborn intensive care unit, helping families and newborn babies. So to further my point in that area, we help with newborns who, one of the areas we may help with is newborns who have been born with cleft lip or palate or both. And we assist in educating the families and also helping with feeding and swallowing. We also work with students, so we can assist in speech and language disorders, which may consist of fluency disorders such as stuttering, literacy skills, which is more of the language aspect, such as reading, writing, and spelling. We also help with individuals who may be diagnosed with autism, with an auditory processing disorder, with struggles in pragmatics, which is social skills. With adults, we can help with voice disorders. Someone may have a voice disorder because they have a polyp or a cyst on their vocal cords and it needs to be removed, and then we assist with therapy afterwards. So that's one example. We also help with patients who have dementia, patients who have Parkinson's disease and have weakness in their speech, people with Huntington's disease and Alzheimer's disease, and we do help, of course, with all ages, people who are deaf and hard of hearing, who have a stroke or a traumatic brain injury and are in the hospital, and we can go in and assist with those patients. Speech language pathology is in high demand currently. There is an expansion of the older population. Some of the reasons are due to increased survival rates because science is constantly growing and developing every day, and we are able to earlier identify and diagnose different diseases and problems, and people are living longer. So it is required for speech therapy services. There are also increased school enrollments, which if there's more students, that means we need more speech therapists. We're also in need of more contract services in the private practice realm. And then there are a lot of people who are bilingual and they may need services in that area. So I thought this was crazy. This quote that says speech language pathology jobs are expected to grow by 25% from 2019 to 2029, and that is faster than the average for all occupations. So we are super, super needed, and it is a very rewarding job, and you are almost guaranteed a job once you graduate grad school. So how do we get there? First, you got to do 2 years of general ed classes. Second, 2 years of upper division SLP courses, which is what I'm currently in right now. After that, you need to go to grad school for 2 years, and this will include clinical hours where you can help out in a hospital setting, a school setting, a private practice setting, areas like that. Then you will be tested and need to pass the praxis exam. And then you will have a 1-year clinical fellowship to earn your C's, which speech therapists really value, and it's really important. It stands for the Certificate of Clinical Competence. And after your name, it will say SLPCCC. And then you are a licensed speech language pathologist, which is super exciting. In regards to salary, the national average is about $99,000 per year. In California, if we look at the schools, it's about $78,000 per year. Hospitals is a little bit more. And then if you go down to working in the newborn intensive care unit, the NICU, that is when we get into the range of $100,000 or more. And then if you're working in home health, it's about $131,000 per year. So I just want to talk about what makes a successful SLP, because there's so much more to it than going to school and passing your classes and passing all the exams, but you need to have a heart to help people. It's so important to be social, to have good people skills and strong communication skills, and want to be there to help in so many areas and diagnose holistically the whole person, not just the certain disorder or disease or thing that needs assistance, but you want to have a heart to help other people. You need to constantly be a student of the profession. The ASHA organization, which stands for the American Speech and Hearing Association, asks you and requires you to continue your schooling to stay up to date with the newest techniques and research and ideas to stay the best speech therapist you can. It's also important to have lots of patience, because there's going to be challenges and setbacks and difficult clients that you're working with, and patience will be essential. You're also going to be working with a lot of different races and ethnicities, so I cannot emphasize enough the sensitivity you need to have towards culture and awareness you need to have towards culture. Even if you don't agree with your client's wishes or the way that they do things in their culture, you still need to be sensitive to that and put your client first before yourself. It's important to be honest and to have excellent listening skills. You want to listen in all areas, and even when you're just getting family history, to be watching and to be listening and taking notes so you can diagnose the whole person. And lastly, I would say perseverance. It takes a lot to get through school and become a speech therapist, but even more after that to persevere through maybe a diagnosis that you're not totally sure on that you need, to collaborate with your colleagues to have the best diagnosis and treatment plan for your client. And you need to persevere through those difficult times for the better outcome and the greater good. So just to wrap up, if you are interested in pursuing this field, you can look on the ASHA website, and they have so much information there about the field of speech-language pathology and audiology. You can research different universities that have the major. It may be titled speech-language pathology, or it can be titled communication disorders. They are the same thing. It could also be super useful to shadow a speech therapist before deciding that's the route you want to go down. I personally did that, and it definitely just assured me in my choice to go and become a licensed speech language pathologist. And honestly, if you have any questions, please email me. I love this field already, and I'm super passionate about it, and I would love to answer any questions you have. Thank you so much.